So as of today, face masks are required on flights into and from the country. This measure follows recommendations for face masks on all public transportation here in Korea. We now have more headlines with our Kwon So-ah and Noaram. Welcome.
Hi.
So let's start on the domestic front. As always, a new cluster infection is raising concerns here.
Yes, unfortunately, an outbreak at a retail logistics center in the city of Bucheon in Gyeonggi-do province, which is near the capital Seoul, has emerged as the latest cluster infection. The government, in its daily morning briefing, said as of 9 a.m. this Wednesday, a total of 36 people related to this new cluster at a distribution center of e-commerce giant Coupang have been confirmed with COVID-19. That's more than double the figure reported a day ago, and the number is expected to grow. Bucheon City has installed a temporary screening center for swift testing on thousands of people and also announced a rollback to stricter social distancing measures starting today. The facility, meanwhile, closed down on Monday when the first case of a worker there was reported. And I don't know if you got the text message earlier from the government. It actually said that people should try to receive packages through non-contact means as of now.
I actually did receive that. So this is the case that is raising our numbers of new infections today.
Exactly. Along with the continuous sporadic cases linked to the Itaewon cluster infection, this Bucheon case led to a jump in daily new cases. And this case may actually be even linked to Itaewon, as an investigation is underway on that. So let's take a closer look at those recent figures. We have 40 new confirmed cases as of this Wednesday, and that is actually the highest number since April 8th, when we had 53 cases. And good news is that we do not have a death reported on this Wednesday, and 20 more people are in quarantine and 20 more people have fully recovered. Although the government has been assuring the public that the situation is under control with daily cases below 50, these recent sporadic infections in and around the capital are raising alarm bells, and authorities are in particular worried about the young generation, as Prime Minister Jung Se-kyun said this morning that young people must help prevent silent transmissions of the virus, noting that in the past 3 weeks, 40% of COVID-19 patients were in their 20s. And with that, he also called on businesses to comply with quarantine measures for visitors at facilities like singing rooms, clubs, and bars. And more caution is needed, especially in the metropolitan area. As we can see on our map, we have 19 new cases in the capital, 11 in Incheon and 6 in Gyeonggi-do province. Also down south, 3 in Daegu, and 1 case was detected at the airport.
Elsewhere around the world, I understand the U.S.'s death toll has surpassed 100,000.
Yes, unfortunately, the U.S. has hit that milestone, which health experts have been forecasting many weeks ago. The death toll in the U.S. topped the 100,000 mark on Tuesday afternoon, according to Worldometer, and that's around a third of the global death toll in relation to COVID-19. The most affected state is New York, with more than 29,000 mortalities, followed by New Jersey with over 11,000 deaths, and many other states have far over 5,000 fatalities, like Massachusetts, Michigan, and Pennsylvania. Meanwhile, the UK has now more than 37,000 deaths, the second highest figure behind the US, with 134 added Tuesday local time. And similar figures have been reported in 4 consecutive days there, suggesting a possible downward trend. However, figures tend to rise in the latter half of the week, with a lag in counts following the weekend. And a country that has had a record high in daily cases Tuesday was Egypt, with 789 infections. The country is approaching 19,000 total cases. Egyptian doctors, meanwhile, are accusing the government of neglecting medical staff working on the front lines following the deaths of 19 doctors and some 350 infections. Now let's take a closer look at the world figures. Again, the U.S. has more than 100,000 deaths now, Let's take a closer look at the mortalities here. The UK, more than 37,000, and Italy, more than 32,000. France also has a high death rate with more than 28,000. And we know that Brazil has become an epicenter with more than 24,000 deaths. And in total, the world now has more than 5.6 million cases and over 352,000 deaths, while 2.4 million people have recovered. And as I mentioned, South America has become the latest epicenter of the virus. And I believe that you're going to have a Skype connection with someone in Ecuador later on. And Ecuador seems to have some stabilizing figures recently, but it has the most deaths per capita. 19 deaths per 100,000 people. So that is a concern over there as well.
Right. So thank you for that. Do stay with me for the summary of the afternoon briefing.
I will do that.
Right. More Korean students are headed to school despite concerns over cluster infections here.
That's right. Now, students in the two lowest grades of elementary school, as well as kindergartners, middle school seniors and high school sophomores return to school today. Now, that amounts to more than 2.8 million students nationwide going to in-person classes. Now, concerns are still mounting after a teacher in Bucheon and a 6-year-old kindergartner, in fact, tested positive over the past couple of days ahead of the school reopening. Now, this has led to some 450 schools and kindergartens to further delay their reopenings, not today, so they are postponing it even further. To ease parents' anxiety, though, the government has increased the number of permissible absent days so that students can stay at home without worrying about their attendance records. Now, also schools have more leeway over scheduling to minimize classroom crowding, such as alternating school days for different classes. Now, the government is advising no more than 2/3 of the entire student body in one time. Now, but this has done little to alleviate the parents' concerns, and they are still calling for a further delay, or they're not sending their children to school at the moment. Now, meanwhile, the government has also announced guidelines for the use of air conditioners, which at this climate is particularly in heavy use in schools as well. But this is more of a general sense. The government is advising anyone using such devices to ventilate spaces regularly and sterilizes the devices often.
Right. Korea is leading global efforts to fight discrimination amid the pandemic, I hear.
That's right. South Korea and 10 other countries have launched a group at UNESCO to promote global cooperation against discrimination and hate speech associated with the COVID-19 pandemic. An inaugural video conference was held on Tuesday with about 110 officials in attendance, including Seoul's Foreign Minister Kang Kyung-hwa. Now, in her congratulatory remarks, Kang said that hatred against foreigners and discrimination erodes the foundation of human rights and hinders efforts to stem the pandemic. She also stressed the importance of world civil education. In a joint statement adopted during the video conference, the group said that it will serve as a platform for solidarity and inclusion to meet the challenges of COVID-19 and beyond.
Now, meanwhile, new research shows that people may contract COVID-19 from animals. Is that right?
That's right. Some worrying news. A few mink workers are reported to have caught the coronavirus from mink in the Netherlands. Now, this could be the first known cases of animal-to-human transmission. Now, mink carrying the virus were found on 4 of the 155 farms in the country where they are bred for their fur. However, Dutch officials say the risk of infection outside mink farms is negligible, in their words. Reports of humans infecting their pets, particularly cats and dogs, have appeared in various countries across the world. However, Dutch officials say the latest mink-to-human transmission was virtually unique. Many scientists believe the virus was actually passed on to humans from animals, possibly in a market that sells exotic animals for meat in the city of Wuhan. That is supposedly the origin of the virus. But the WHO says China had agreed that an investigation into the origin of the virus was needed, but did not say when that will take place. Now, the WHO says it is in close contact with Dutch researchers investigating the latest cases.
All right, Aram, thank you for that. We'll see you again tomorrow.
Thank you.
It's a little past 2 in the afternoon here in Seoul, and we are poised to join the regular afternoon briefing on COVID-19. But before we do that, here is a little more information on the guidelines by the government regarding the use of air conditioners this summer. Health authorities are calling for efforts to ventilate the room at least once every 2 hours. Also, in the case of air-conditioned spaces without windows, users are being advised to wear face masks What's more, avoid coming into direct contact with the air from these devices, and also avoid keeping the air conditioners on at full power and instead opt for a weaker fan speed. Refrain from direct contact, like I said, and refrain from using them alongside fans. On the subject of guidelines, here are also the daily life or everyday quarantine guidelines that health officials are asking members of the public to abide by. Oh, I see that the briefing is going to start right now, so we'll come back after this.
Let us now begin our regular briefing for the COVID-19 response. As of May 27th today, we have 40 new cases, and the total number of confirmed cases now stands at 11,265. And 20 more people have been recovered, and a total of 91.4% have been recovered, and a total of 701 people are in quarantine undergoing treatment. Out of the 40 new cases, 3 were imported, while the 37 were local transmissions. Of the imported cases, 1 or 2 was from America and 1 from the Philippines. And as for the local transmissions, we have a few updates. As for the biblical language study meeting, we have 3 new more cases, and a total of 12 people have been confirmed as to date. And this person was reported reported to have in contact with a member of the Jusaran church, and both of them, 2 people were from there, and 1 person was a teacher at the Bucheon in Gyeonggi-do province. Related to the Kupang Logistics Center in Bucheon City in Gyeonggi-do province, we have 22 additional cases, and a total of 36 cases are related to this cluster as of now, and testing is underway for all of the workers of the logistics center. And of the 36 confirmed cases, 32 are the workers and 4 were the family members. And 22 were from Incheon and 10 from Gyeonggi-do province and 4 in Seoul City. As for this logistics center, we have identified that there are a total of over 4,000 of workers working there, and as of yesterday, we are conducting the screening testings at the screening center, and right now about 1,900 have conducted the testings. And starting from the 10th of May, we advise you, if you have started working at the Kupang Logistics Center in Bucheon City, we ask you to also be on self-quarantine. And if any of your family members work at schools or other multi-use facilities, you should also stay home. And there were 2 people confirmed in Daegu, and they also have been tested positive, and additional of 1% has been tested positive in the investigation of the confirmed cases of the senior volunteer group, and 1 senior student at Osong High School was also tested positive in Daegu. And we had 4 more patients confirmed relation to the Itaewon Club, and the total now stands at 295, and 96 of them are visitors to the club, while 163 were the contacts. And in an effort to stop further local transmission of COVID-19 within communities as early as possible, KCDC is conducting mass testing of persons who visited public venues and events visited by confirmed COVID-19 cases. Persons who visited such places during the respective specified time period are advised to visit a screening clinic and get tested regardless of symptoms. And we have a list of the venues, and they have been updated today, and they include all of the visitors, all of the places that the visitors have, the confirmed cases have visited, and they include those places that have been visited by the confirmed cases from the Kupang Logistics Center in Bucheon City. As we said yesterday during the briefing, regarding the surveillance and investigation system for domestic cases of multi-system inflammatory respiratory syndrome in children and teenagers. We had 2 suspected cases, and one was an 11-year-old boy and one was 4-year-old girl. And both of them tested negative at the PCR testing conducted by the hospitals. And as for the 11-year-old boy, has visited the Philippines earlier this year. And in order to identify whether they have been confirmed or infected by the coronavirus, we are currently conducting the antibody testings. So after these analyses, we will be deciding whether this is a case of such a syndrome. And we believe that the outcome will be revealed early next week. And both of these cases have been making recovery, and the 11-year-old boy has already been discharged from hospital, while the girl will be discharged very soon as well. Today we have the second phase of returning back to school for many school students, and we also highlight the importance of following of infectious disease prevention control measures. And we believe that ventilation of the classrooms by opening windows, maintaining distance with friends, and keeping face masks on at all times. Also, maintaining personal hygiene like washing hands and using hand sanitizers is also very important. And we ask the students to avoid visiting karaoke rooms, PC cafes, or other multi-use facilities. And in light of the recent rise in the local transmissions related to clubs, bars, karaoke rooms, restaurants, and after-school academies, we urge people to refrain from going to these enclosed and crowded spaces. And if you belong to high-risk groups, including senior citizens over the age of 65, pregnant women, persons with chronic illnesses, should especially avoid any poorly ventilated enclosed spaces frequented by many people. And if you need to visit these places, you need to wear a face mask as well. And at the businesses and office spaces, we ask you to be vigilant and continue to wear a face mask when you visit the multi-use and shared spaces. And as for the smoking rooms, we ask you to refrain from using and please smoke outdoors if needed. And on bus rides and in commuting to work, and we believe that disinfection is very important. And as for the company restaurants, dining rooms, we ask you to have distancing in between the people so that we can decrease the risk of droplet infection. And if you have come in close contact with a large number of unspecified people in an enclosed and confined space, you need to visit a screening clinic through the Public Health Center or 1339 call center. And we urge you to visit a screening clinic and get tested, especially if 2 or more persons within a family or social group develop COVID-19 symptoms. Starting from today, we have an expanded resumption of schools, and we ask the members of the public to comply with the quarantine protocols so that we have no risks of infection at schools. And if there are emergency cases like a confirmed case in schools, we ask the schools to continue to cooperate with the quarantine authorities and the local governments. The quarantine authorities are currently exerting our full efforts to contain the virus. However, we are continuously witnessing a large scale of infections and sporadic outbreaks throughout the metropolitan area. So we ask you to comply with the quarantine government's, quarantine authorities' quarantine measures. And this is a matter of time. And in order to curb further infection, we ask you to take voluntary testings so that we can identify identify and diagnose the patient at an early stage, and this is the most crucial aspect. As mentioned before, if you have visited the multi-use facilities like the singing rooms or the bars that have been visited by the confirmed COVID-19 cases, we are disclosing these list of information on our KCDC homepage as well. So if you have visited these places, please get tested regardless of your symptoms. Thank you very much.
Right, that was Chung Young, the head of KCDC, with Wednesday's afternoon briefing. Swa, do give us a summary of the key announcements.
All right, we have 40 new cases as of this Wednesday, and this is, we have a number at this level for the first time in 49 days, according to Chung Eun-kyung, the chief of the KCDC. And it looks like 37 were local transmissions and only 3 were imported cases. And we also have 36 cases related to the Kupang Logistics Center, as I mentioned before. So it looks like there have been no additional cases as of between this morning and this afternoon. But out of these 36 cases, 32 were workers at Kupang and 4 were family members. And currently, tests are underway on some 1,900 people, most of them working at that logistics center. And these infections occurred in people in Incheon, Gyeonggi-do province, as well as the capital, Seoul. And meanwhile, in relation to the cluster infection in Itaewon, now the total number of confirmed cases stands at 259, and there has also been a new infection in Daegu, where a senior high school student has been confirmed with the virus, and that, as again millions of students have returned to school this Wednesday. That's why Chung asked for cooperation from the nation's people. Also, when it comes to wearing masks, as she asked for people to also wear those at rest areas, changing rooms, as well as smoking rooms. And that's some new information that we actually heard from her today.
All right, so thank you for that. We'll see you again tomorrow.
Thank you.
Staying on the domestic front, the government has been holding weekly sessions on Thursdays, presided over by Prime Minister Chung Se-kyun, to tackle matters related to COVID-19 and to prepare for a post-pandemic world. In the most recent conference, officials here looked into ways to tackle the economic challenges triggered by the global outbreak. Let's take a look.
Chaired by Prime Minister Chung Se-kyun, South Korea has been convening the so-called Thursday Conference on a weekly basis, starting from late April. The fourth gathering of the Thursday Conference, which took place on May 21st, invited economic, industry, and job experts to discuss countermeasures to the economic fallout of COVID-19 and ways to promote renewed growth.
코로나19의 충격으로 세계 경제는 100년 전 대공황과 비견할 만큼 심각한 위기에 처해 있습니다. 세계는 지금 전쟁 중이라고 해도 과언이 아닙니다. 우리 경제는 수출이 급감하고 서비스업의 위축과 제조업의 위기가 확산되고 있으며 자영업자와 근로자들은 실직의 위험 속에 놓여 있습니다. 앞으로 이 파고가 얼마나 갈지 또 언제까지 지속될지 아무도 알 수가 없습니다. 그러나 기다릴 수만은 없습니다.
As a possible means of warding off the economic crisis, Prime Minister Chung emphasized the need to pivot Korea's economy towards digitization.
한국판 뉴딜을 통해 디지털 경제를 위한 인프라를 구축하고 바이오 헬스, 미래차 등 신성장 산업을 적극 육성하여 새로운 일자리를 창출해야 하겠습니다. 그 과정에서 불필요한 규제는 과감하게 혁파하겠습니다. 아울러 공직사회의 적극 행정을 더욱 챙기겠습니다.
A lively discussion took place among the attendees after Prime Minister Chung's speech, which started with an economic outlook of the post-pandemic world from a financial market perspective.
코로나가 지나게 되면 서비스업이 굉장히 심대한 타격을 받을 거다라고 생각을 합니다. 이제 서비스업이 가진 특징은 3가지가 있는데요. 첫 번째는 이연 소비라는 게 없습니다. 서비스업은 날아간 수요를 회복할 수가 없습니다. 또 두 번째는 서비스업은 기본적으로 영세한 사업자들이 굉장히 많습니다. 또 세 번째는 서비스업은 기본적으로 기저질환이 있었다고 생각합니다. 아마존이나 이런 비즈니스가 약진을 하면서 기존의 자영업자들은 이미 기저질환이 있었기 때문에 서비스업이 제 생각에는 글로벌하게 심대한 타격을 받지 않을까 걱정이 되고요.
So how should South Korea respond to this unfolding economic crisis? Analysts agree that uncertainty was the one factor exerting the most downward pressure on the economy amid COVID-19, and underscored the need to minimize economic shocks in the immediate aftermath of the pandemic in order to encourage stable recovery in the long term.
A점에서 이제 충격이 왔을 때 초기 충격을 얼마나 최소화하느냐가 그 이후의 궤적에 굉장히 큰 영향을 미칩니다. 초기 충격에 대해서는 초기 방역과 피해를 보는 취약계층하고 취약 부문을 적극적으로 보호하는 것이 중요하고요. 두 번째 단기 쪽에서는 위기 탈출 그리고 경기 회복을 위한 출구 전략을 실행하면서 중장기 전략을 마련을 해야 됩니다.
Prime Minister Chung also contemplated ways to restore public confidence in the financial markets, just one of many agendas that were discussed regarding economic recovery in the post-pandemic era.
금융시장에 대한 국민들의 신뢰 회복 이런 것들이 매우 중요할 것 같은데 앞으로 그렇게 건강하게 우리 금융시장이 더 발전할 수 있겠는지 또 젊은 투자자들이 떠나지 않고 오래 머무르면서 이 국민들이 가지고 있는 지금 과도한 부동자금이 산업자금화할 가능성은 있겠는지 그렇게 되기 위해서는 금융계가 어떤 노력을 해야 될지 등에 대해서 좀 간단히 한번 말씀해 주시면 좋을 것 같습니다.
부동산 쪽으로 돈을 가는 걸 막으려고 하면 다른 쪽으로 나갈 수 있는 저는 그 물꼬를 터주는 게 맞다고 봅니다. 그렇게 보면 이제 주식에 대한 양도차익 과세가 강화가 되는데 저는 그건 맞다고 생각합니다. 소득이 있으면은 세금을 내야죠. 그래서 과세에 대해서도 조금의 속도 조절 같은 것들도 한번 좀 고려해 보실 만한 정책이 아닌가 조언을 드리고 싶습니다.
The fourth Thursday conference was a fruitful event that led to constructive debate on ways to save the country's ailing economy amid COVID-19. Korea is continuing to take small steps forward to adjust to the myriad of changes that are now happening in the world's economic and industrial landscape.
Elsewhere in the world, Latin America, for its part, is facing an unprecedented challenge economically, politically and socially in light of COVID-19. For more on the situation there, I have live on the line Ha Sang-uk, an attorney practicing law in Ecuador. Hello, Mr. Ha.
Hello.
I understand the healthcare system, Mr. Ha, in Ecuador has been overwhelmed by the outbreak. Bodies have been left unburied and some of them even lying on the streets. Could you please tell us a bit more about the situation there?
Sure. Yeah. In April, we were all shocked by some videos posted on social media showing dead bodies on the street of Guayaquil, the largest city of Ecuador near the Pacific Ocean. And the public services and the people of Ecuador were not prepared to deal with this kind of overwhelming pandemic. And all the hospitals, the mortuaries, funeral homes, and the cemeteries were immediately collapsed. And I've never seen such a human tragedy with so many corpses lying on the street of Guayaquil. And the people, desperate, started calling 911, but it took many days until the help could come to the homes. And they had many people dying and dead inside home. And it was terrible to see how the relatives' bodies were decomposing inside homes. So now the things seems to be normalizing. According to latest official statistics, the number of COVID-19 infected people in Ecuador reached some 37,000, while the COVID related death toll surpassed 5,000. The mortality rate in this country of 70 million people reached almost 14%, is quite high. And I think the main reason why the growth of COVID-19 cases in Ecuador is not stopping is, in my opinion, due to the continuous lack of obedience of the people to the public health guidelines implemented by the government. Yesterday, the public health minister expressly announced that some 54% of the people in the metropolitan area of Quito are not complying with the protocols, and they are breaking the lockdowns pronounced by the government. And there still is an overwhelming problem in the rest of this country.
I see, Mr. Ha. There have been reports, Mr. Ha, of goodwill gestures by Koreans in Ecuador by offering face masks and free food to the less fortunate. Do tell us more about this.
Yes, despite the fact that the Korean community in Ecuador is relatively small, composed of 500 people, mainly living in Quito and Guayaquil, we could raise a very important and significant amount of fund to donate to the Ecuadorian government. Specifically, some 2 weeks ago, we successfully donated some 1,200 emergency kits of food, as well as 500 face masks. So Maria Paula Romo, the Minister of Interior of Ecuador, received personally our donation in a public ceremony, thanking for our solidarity and our humanitarian help from the Korean community here in Ecuador.
All right, Mr. Ha, let's hope such acts of compassion spread faster than the virus. Thank you very much for joining us live at this hour from Ecuador.
You're welcome. Yeah.
Pundits fear the COVID-19 pandemic may further widen the socio-economic gap between the haves and have-nots. Now, to better address these disparities and to explore efforts to ease the gap, I have So Hun Sop, Special Representative of the World Bank's Korea Office. Welcome to the program, Mr. So.
Thank you.
And I also have Professor that is, Kim Se-won from Ewha Women's University. Good to see you again, Professor Kim.
Good afternoon.
Professor Kim, amid the pandemic, we are further witnessing this polarization in many aspects of society, and this phenomenon is much more pronounced in the economic sector. What can you tell us about this reality with regard to the Korean economy?
When economic crisis comes in, the top priority is given to recovering economy fast, like increasing GDP and employment. But almost every economic crisis ends with widened income gap between the high-income people and low-income people. The same is happening in Korea over COVID-19 crisis. According to recently released data from Statistics Office of Korean government, in the first quarter of this year, the upper 20% income households increased by over 6% compared to the last year. However, the bottom 20% households' income is not changed at all. So consequently, the ratio between the two, between the upper 20% and bottom 20%, which is the key barometer of income equality, became 5.41 in the first quarter of this year. So that is over 0.23 increase compared to that of the last year's first quarter. So we can broadly say that income inequality is accelerating quite quickly after outbreak of coronavirus.
And that, of course, is quite alarming to hear.
Right.
The polarization pattern, of course, is nothing new. I mean, we saw it even in the aftermath of the 2008 financial crisis. How did Korea address that issue back then?
Well, we have economic crisis, for example, back to 2008 over global economic crisis. So that economic crisis generated income inequality in a certain way, but that, I think, has been integrated in Korean economy in a way of changing industry structure and labor market structure. In 2009, after 1 year outbreak of global economic crisis, the income ratio between top 20% and bottom 20% was 4.97. That is steadily increased over 12 years until 5.41 of first quarter of this year. So when we were hit hard by income inequality, which is generated by economic crisis, we can say that that effect is almost forever in the case of Korea.
It's a long-term effect.
Right.
I see. Mr. So on a global scale, developing countries face a greater risk of being left behind. What is the World Bank's outlook on this reality?
Well, I think there's a general agreement in 2020 as a result of coronavirus. We will see a major global economic contraction. In fact, the World Bank publishes its global economic prospects, which is our main publication that shows our projections for global economy and the various challenges. It should be coming out on June 8th, so we will see more specific projections then. But I think what we'll see is a major contraction, perhaps one of the biggest and perhaps even bigger than the global financial crisis contractions. And I think you'll see various differentiation across the level of development. And in fact, I expect the level of contraction to be bigger for the more advanced high-income countries compared to the lower-income countries. However, having said that, all countries will take a hit. And I think the lower-income developing countries will be particularly vulnerable to the impact of the coronavirus-induced economic impacts. And as a result of those impacts, I think in almost close to 2 decades, we will see an increase in the global extreme poverty rate. We've seen a steady decline in those rates over the last decades, and I think as a result of the coronavirus impact, we will see a slight increase in the rate of poverty. Developing countries are particularly vulnerable because they tend to have less resources and less capacity to deal with the impact of the crisis. For instance, they have weaker health systems. The poor have, even within the health systems, the poor tend to have lower access to the health systems. The poor are more vulnerable to job losses because they don't have resources and savings to address the loss of income. Developing countries tend to be more exposed to global economic impacts, for instance, to disturbances in the global value chain, which developing countries tend to rely on to export. We see, for instance, developing countries that rely on commodity exports. We think they will be particularly exposed to the crisis, as well as countries that depend on tourism, et cetera. Mm-hmm. So I think we have to look at carefully, monitor the impact on the crisis on the developing countries.
Which is why market experts like yourself say this problem in developing countries poses a tangible threat to the stability of the global economy as a whole. I'm sure you agree then.
Yes, I agree. And of course, this is an impact that we expect to see across the different countries, not just developing countries, but also developing countries. The global economy over the years have become much more integrated, and what impacts one part of the global economy is easily transmitted through both real channels and financial channels to other parts of the global economy. So you can see an impact transmitted both ways between developing and developed countries. And so we need to be aware of the total package of impact on the global economy. But having said that, again, from the World Bank's perspective, we're particularly sensitive about the possible impact on developing countries. What we've seen is, since the global financial crisis, there's been some increased vulnerabilities of some of these countries. For instance, we've seen an increase in government debt. And as a result, if you have disturbances in the global financial system and these countries have financing needs that cannot be met by external financing, I think this is the kind of situation we need to monitor very carefully.
Right. Now, the uneven distribution of wealth and access to public services is not simply a problem for underdeveloped nations. A similar reality can also be seen in the US as health authorities tackle the world's worst outbreak. For more on this, I have Professor John Mutta from Columbia University live on the line. Hello, Professor.
Hi, how are you? Thank you for asking me to come on the program.
Thank you for being with us, Professor. Professor, what can you tell us about the widening socioeconomic gap in the US amid the pandemic?
So, in some ways, this is no different from what we see in every sort of natural disaster. The poorer people, even in wealthy countries, are more affected than wealthier people who have the capital, they have the resources, they also have the information to know what to do. Poorer people, particularly in New York, for instance, here, where I live, Harlem is one of the most densely populated parts of New York. So is the Bronx. So it's very easy for transmission to occur. There are many family situations where there are children, parents, and grandchildren all in the same living area. And elderly people are more vulnerable, mostly because they have pre-existing conditions. But this is a recipe for high rates of infection. They also don't have the same access to healthcare. They don't quite know what to do if somebody gets ill. So there are many, many reasons that make it more difficult for people in poorer circumstances to understand what's happening, to seek the proper medical services, and to access them. So we see this in every sort of disaster. Hurricane Sandy was this way. The poorer people are always more disadvantaged,
right,
than people who are savvy, and wealthy. They know what to do.
Professor Mutta, in your opinion, are there any ways of resolving this issue then?
So this is really difficult. Every natural disaster, and this is one, exposes inequalities. It makes inequalities evident, right? It shows us inequalities that we might not be thinking about very much. The more serious question is, do these sorts of events exacerbate inequality? Do they make inequality worse? My studies would suggest that they do.
I see.
So the most important thing is not to tackle these issues event by event. What's going to happen in Hurricane Sandy and Hurricane Katrina, in every individual one. It's, why do we have this extreme inequality in the first place?
Right.
And how can we address that?
All right, Professor John Mutta, thank you very much for making the time to join us live at this hour.
I'm pleased to do that. Thank you.
Professor Kim, the government here is mulling over the feasibility of adopting a basic income plan.
Right.
Now, discussions are well underway by policymakers ahead of the 21st National Assembly. What might a basic income plan look like?
Well, that is a really tough question. But in the last few years, we have heard lots of attempts on basic income from European countries like Switzerland and Sweden. But that was not well accepted in Korea, along with other countries, because people had something psychological barriers on basic income. But after experiencing emergency income support from government over COVID-19 crisis, government and people's attitudes on basic income has been changed, and they begin to also recognize that basic income could be an effective measure to improve income equality and so on, along with stimulating economy. But still there remains big question of who's going to pay for it. So for implementing basic income in the future, we have to have something social and political agreements on payouts of basic income from whom. So I think that is very important problem in taking care of basic income in the future.
Right. Mr. So, very briefly speaking, how can we fundamentally address the issue of economic polarization in a post-pandemic world?
Well, I think, first of all, we have to approach it in a comprehensive manner. And in fact, the World Bank's main mission is to eradicate extreme poverty and to promote prosperity. And so we approach this goal in a very comprehensive manner by promoting investments, both in physical capital and also in human capital, because you need to build the human capital of the poor so that they can gain the knowledge and skills to upgrade their income potential, for instance. We help countries think about and enact necessary reforms of their policies, for instance. And all of these are, I think, important to ensure that developing countries improve their ability to grow and to also address their own poverty. And by doing so, I think we also, of course, on a global scale, help address the gap between the developing countries and that way address the global disparity or polarization, as you refer to. And within this program of investments and policy support, there are various engagements that we do that specifically address the poor. For instance, we help countries build up their poverty-related systems so that they understand who the poor are, so that they can target the poor better. We help them build up and strengthen their social protection system and social protection and insurance systems, because traditionally these systems have tended to be on a smaller scale and underfunded. And so we help countries think about how to expand those programs and to, again, improve the targeting mechanism so that because we know developing countries lack resources, relatively speaking. So we have to make sure that they use those resources smartly by targeting the people who really need assistance.
Right. All right, Mr. So, thank you very much for being with us. And Professor Kim, as always, thank you for making the time to be here.
Thank you very much.
Thank you.
Right, we end the program on that note today. Tune in tomorrow at this hour as we discuss the impact of no-contact interactions on companies. In the meantime, do share your thoughts and inquiries with us via our social media accounts or our homepage, arirang.com. Thank you for watching.